Good afternoon and welcome to Webinar Wednesday. We're excited to have over 360 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a Webinar Wednesday lunch bag for answering this trivia question. Which city is hosting this year's Super Bowl? Answer now using the questions feature on your dashboard. While you're answering, I want to remind everyone that our first conference of the year, our annual Imaging Expo and Conference, is fast approaching. We'd like to invite you to join us for ICE, which will bring imaging service professionals from across the nation for 3 days of learning, networking, and the latest advances in imaging. We look forward to you joining us at the Wyndham Grand Resort in Clearwater, Florida, from February the 17th to 19th. Registration is open and more details can be found at attendice.com. Also, just a quick reminder that our MD Expo will be taking place at the Marriott Hotel and Convention Center in Houston, Texas, from April 11th to 13th. Registration is also open for this expo and more details can be found at mdexposhow.com/Houston. Okay, and let's see who the winner of our Webinar Wednesday lunch bag is, and it is Philip White. Congratulations, Philip. Of course, the correct answer is Atlanta. Webinar Wednesday would like to thank our sponsor, Nuvolo. Nuvolo is a modern cloud-based EAM platform that meets the highest standards for ease of use, performance, and online and offline mobility capability for managing clinical equipment for healthcare providers. Visit nuvolo.com for more information. Our presenter today is Peter Goltz, Director of Solution Consulting at Nuvolo. Peter, you may begin whenever you're ready.
Very good. Thank you so much, Linda. Hello, everyone. Today we'll be talking about the future of vendor management. Many organizations today are of course, operating with high variations of either in-house technicians, fully outsourced, partially outsourced, and perhaps it's just for those highly specialized equipment, like some sort of imaging technology. The purpose of today's conversation is to talk about how we can help you enhance your managed outsourced providers and how we can help increase efficiencies, accountability. As Linda mentioned, my name is Peter Goltz, and here's a quick look at today's agenda. We'll start off talking about the current approach and some of the challenges with today's approach when it comes to vendor management. We'll then hop into and talk a little bit about the future of vendor management and some of the different areas that you can think about and different considerations as you're looking at enhancing your vendor management program. And then we'll hop into Nuvolo's technology. And the purpose is to make it very educational, to show you some of the things and considerations as you're building out your program. And if you have any questions throughout today's presentation, feel free to put them into the chat box, and we'll go ahead and answer as many as we can at the end of the presentation. So let's start off talking about, what today's approach is, and then we'll talk a little bit about some of the challenges that come with that. So a lot of times working as a biomed team, working with an external vendor, oftentimes it's very one way when it comes to the communication. Right? You all know the scenario. You notify a vendor of the assignment or of the project that they've been, that they need to take care of. And oftentimes you don't know it's complete or closed until you receive the invoice in the mail. Oftentimes both the documentation, the field service report, and that invoice is all paper-based. So when it comes time to then upload into your CMMS application, it involves a lot of manual entry, whether it's typing in the labor charges, who performed the work. And what that means is when all of that feedback is delayed because of the manual entry, because of the paper-based documentation, because of that one-way communication, oftentimes that feedback loop, that communication loop becomes reactive, where if something's delayed, or perhaps if they need to come back on site to fix the device, it's oftentimes, past the point of where it could have been helpful. no longer proactive. And without those real-time updates, it then becomes very difficult to have visibility. When we think about some of the challenges that come with it, there's really three main areas we can think about. Little visibility, little accountability, and also no efficiency in the way that you can operate. What that results in is, oftentimes higher cost and lower quality of the work that's being performed. When we think about no visibility, visibility comes into play when you're tracking the status of your work orders. You don't know who completed the work, when it was completed, and also what was left to be complete. Perhaps they're coming back on site in a few weeks. Also accountability. So without the ability to properly measure what's being completed, it becomes very difficult to enforce any type of accountability with the vendors and the data that they're submitting, whether it's through the invoices or the work orders that were completed. And then when it comes to transparency and efficiency, paper-based work orders make it very hard to then manually transcribe that info into the asset service history within the CMMS. And at that point, you then have multiple paper documents when it comes to things like joint commission reports, many different formats. So when we think about the future of vendor management, here's a few different types of considerations. The future of vendor management is taking advantage of modern automation to then get a better insight into what's going on within your organization. We want to enable a vendor to capture all of their work details at the point of service with a mobile application, documenting exactly what was done at the point of completing that work order. All of that then gets sent to the biomed organization, which can then, perhaps if there's invoices, having detailed invoices, being able to approve that invoice, and then also the reporting that comes along with that. So as you're accumulating this data, this insight into your day-to-day operations allows you then to have real-time insight to see what's been completed, what's not been completed, the cost doing business with certain vendors, cost of service of specific equipment, and then also automating the assignment to specific vendors that are your highest performing. So when a work order comes in for a specific, let's say an imaging device, at the point of it being identified, it can be automatically routed to a specific vendor. We'll take a look a little bit about how we can do that throughout this presentation. So let's go ahead and hop into the application. And what we'll be looking at is how we can increase that visibility by giving you real-time insight into the status of different work orders, the work that was performed, and knowing exactly when it was completed. We'll then talk about increasing accountability by giving you the ability to track the quality of the work, and then also holding vendors to the labor rates that were described in the contract, having visibility into the contracts that were first outlined, and then also taking advantage of things like the warranties associated with your equipment, everything being timestamped, when it was complete, when they were on site, and then efficiency, making it very, very easy for your end users, your customers, to submit a work order request through something like a self-service portal. Taking advantage of that auto assignment, which I mentioned, where when a work order comes in, it could be automatically assigned to a specific vendor that you work with. Taking advantage of things like digital invoicing and digital approving. So within your dashboard, you can see all of the invoices that have been submitted, and you can approve them one by one while also having visibility into the work that was completed. So as I mentioned, we'll be spending most of today's presentation in the Nuvolo application, and we'll first talk about how we can increase the visibility for both yourself and your organization. What we're looking at here is what we call a vendor portal. This portal is a place where you can assign work out to an external provider. They can log in and then have access to all of the work that's been assigned to them. What this does is it gives them visibility into work that's assigned to that organization. You can be using the same type of reports that are important to you, whether it's tracking SLAs or work completed year to date. What it also gives them access to is the work that's been assigned to them. From that point on, they could be entirely self-sufficient. They can bring in their own technicians by managing their users. They can create work order itemized costs. And they can also prioritize their work based on when that work order was due. So when it comes time, when you ask the vendor or the external technician what the status is, all of this information that's been updated is automatically communicated to your dashboard. So you have real-time visibility into that information. So that's one portion. Having visibility and giving your external vendors visibility into the work that's been assigned to them. And at the point of then them updating that work and completing that work, you'll then know in real time when that was updated, when it was closed, and you can see exactly who completed that. We'll be spending more time talking about work orders, but before we do that, let's also talk about internal visibility. So tracking, managing all of the different metrics, the KPIs that are important to your organization. What we see here is we're within the Nuvolo application. Once again, I'm a logged in user, but in this scenario, I would be the biomed supervisor or director of a hospital or healthcare system. Within my dashboard, I can have a quick glance at all of the KPIs and statistics that are going to be relevant. Things like tracking, which SLAs were achieved or breached by different vendors. Having visibility to different trends that are going on, whether it's SLAs breached per month. And then also understanding anything that's been past due or tracking the response and the agility of the vendors that you're working with. Here you can see things like request to completion. So at the point of a work order being assigned to a vendor, the time that it took for them to then complete it. You can average that out to have visibility on how long or what the estimated time to complete is. And then also things like the associated costs. So this is something that you definitely want to take into consideration, is not only managing your external providers by things like, are they completing the work on time? Is it complete? Things like first contact resolution, but also understanding the costs associated to doing business. What you see here is tracking things like labor and parts spent on a quarterly basis. And then all of this then can fall in line with the contracts that you have in place. Within those contracts, you can be tracking any type of contract cost that's been incurred so far, and then also the return on investment. So also taking into account, when you have visibility into these metrics, making sure you're taking advantage of your specific contracts that you have in place. So that's a look at the vendor scorecard, understanding the different scores or metrics that you hold your vendors to. And also what's nice is because where we started was the vendor portal. These type of reports and dashboards you can display directly on the vendor portal. So what that means is when the vendor logs in to view the work that they've been assigned and completed, they can see exactly how they rank up against either the other providers or perhaps just themselves on the benchmarks that you set. When we think about benchmarks, you also want to have the ability to then compare external vendors to the work that's being done internally. Here's ability for you to see all of the internal work that your biomed has been assigned and is completing, tracking things like unfinished work, overdue PMs. This also gives you the ability to then balance that workload out to different individuals or external providers if, for example, you have too much work based on the resources you have allocated. So let's say, for example, we have our overdue scheduled maintenances. Here what we can do is then drill into that, reassign them to an external provider, and then at that point it would then show up on their vendor dashboard where they can then complete that. So at the point of a vendor receiving a work order, they can then open it up just like we've done here. What that then gives them the ability to do is document all of the work that's been performed. Here within a work order, work orders can be done either on a mobile application or within the desktop or laptop itself. But as this information is being updated, it's being captured in real time, then automatically updating in dashboards you may be tracking. Here you can see the status. So at the point of this work order changing to status of close complete, or perhaps it's an approval, that could be automatically communicated. You can have visibility into that. Also, as they're completing this work order, you can have checklists to then document each of the steps that were followed as you process through this work order. What you see here is yes, no, pass, fail. These are things that you can describe as an organization what you want these steps to be. Perhaps it's a check-in process. Perhaps it's the exact manufacturer steps that you need followed. What this then gives you visibility into is exactly what was performed, perhaps what type of tests or procedures might have not been completed. And at the point of submitting it, that then goes to the equipment service history. So you know exactly what was complete and what was not complete. And then also when we think about visibility, having real-time insight into the SLAs that you may be tracking. At the point of a work order being created, what you can see here is the priority and how this SLA is being tracked towards completion. Within this SLA, you also see things like time left and business time left. This makes your vendors then accountable to the SLAs that's been described. And then also, let's say, for example, this work order is going to be overdue or is coming close to that due date. At the point of it going to becoming almost overdue, it can then be sent into an escalation or notification. As an organization, you can describe exactly what that escalation process would be. Perhaps it gets sent to a supervisor or director at the point of it being due in the next day and still not being complete. So that's a look at how you can get more visibility into your vendor management program. Let's now go ahead and take a look at the aspect of accountability. When something is complete, or perhaps something is going to be overdue, you want to be able to track that and know how vendors have stacked up against the contract or the terms that were first agreed upon. We're first going to go ahead and start off in the mobile application and talk about giving access to your vendors when they come on site and being able to complete work orders directly within the mobile application. There's a concept called geofencing, and it's a very interesting concept because it then gives you the ability to enforce certain rules based on the location of a technician. So let's say, for example, I'm a technician, I received a work order. Perhaps you can set up rules, or you say, I don't want this work order to be able to be opened or closed unless they're within a certain proximity of the building or of that location. Also, as they then go to process through the work order, you can also be taking advantage of things like taking pictures or signatures when the work is complete. What you see here is a work order. They can document and receive all of the information that was provided when this work order was completed, tracking the amount of time that it took to process through this work order. Again, the documentation, making sure that all of the steps being followed are documented. And then things like taking a picture, adding a signature. Once the work is completed, a picture can be taken. Let's just go ahead and take a picture of the table here, add it to the work order. And once we've added to the work order, it can then be referenced back to either it's the invoicing process or perhaps just tracking, service history for a specific device. And then also the signature process. So at the point of the work being complete, perhaps you're having them get the signature of someone within the hospital or health system. As they complete this work order, there's also the concept of mandatory fields. As we go back to the initial screen here, what you can see is some different information that needs to be captured before this work order is complete. Let's say, for example, they didn't capture the information that you wanted them to, and they tried to complete this work order. At the point of trying to complete that, you can see here I'm then prompted as an external technician saying this information is blank. In order to close this work order out, you need to capture that information. So that's a way to capture work notes, resolution codes, to make sure that any external technician is following the procedures that you've outlined in order to work with your health system. So that's a quick look at managing accountability within the mobile application. What we'll now do is take a look at how you can set up your external providers within the application, and then you can hold them against the rates that are described. So here you can see we're setting up an external provider within the application, identifying what type of supplier this is, whether a manufacturer or service provider, describing what the labor rates, travel rates, parts discounts are. And as you're entering this in, you can also capture the equipment that they may be responsible for, the contract that's been described. And within that contract, you can also further detail out the information that's going to be most important. Perhaps it's a specific SLA. Perhaps it's your coverage details, understanding is preventative, corrective warranties covered. And then also, one of the things I mentioned earlier on in the presentation was the concept of an ROI, tracking, what type of return are you getting through this contract. Within your contracts, you can also have understanding of the different parts that they may be adding to your equipment, the contacts that you can reach out to, and then also the different individuals or technicians that may be working within your organization. I've talked a lot about the service history of a medical device and utilizing that to ensure everything's being documented. When an external technician is in your hospital working on a device, you want to make sure that all of those steps and procedures were captured. What we'll now look at is taking a look back at a medical device and seeing all of the information that was captured when this work was being completed. Just to quickly give you an idea of what we're looking at here within a clinical device or medical device, we have all the unique identifiers, things like unique asset tags, barcodes, any classifications or segmentations. The last known location, also very relevant in the sense that if someone that's not familiar with the layout of your organization, being able to pull up on a map and see exactly where that device is located. Here you can see it's pinpointed on the map. As also the work is being completed, you can see here tracking the service history. So that's where point of service allows you to help enforce accountability. So when a work order is complete, you can go ahead and drill into that and see exactly the steps that were followed, understanding the contracts that are associated with it, and then also taking advantage of when that external provider is on site. Perhaps there's a preventative or scheduled maintenance coming up over the next few days. Here you can see you have visibility of when that's due and the type of work that needs to be completed. And then also the parts consumed. So as an external provider is adding a specific part to this device to fix it, you can then have visibility on exactly the part that was added and the total cost of that. This cost becomes very important when you then start tracking things like repair versus replace type of data. Here you can see things like total labor cost that's being accumulated as either your internal or external technicians completing a work order. They added their labor. That then accumulates into things like total labor costs or materials, tracking things like cost of service ratio, or perhaps more of your list price acquisition costs. Also, something that is very helpful when you think about accountability is all of the different things that are happening within the application are then time-stamped. So let's go ahead and quickly just take a look at a work order. As we're looking at that work order, we can see all the steps that were followed, any type of itemized costs or checklist items. And then also, if this were completed, you can see here, we can go ahead and look at exactly when this all happened. Within this list view, you can see, when was the estimated effort added? When was the checklist completed? At what point was this work order added, created by one of the nurses? This then gives you the ability to track these type of duration metrics, understanding requests to completion, or once it's been accepted to completion. So that's a look at accountability, making sure that you're measuring to give you the ability to manage your external vendors better. Let's now go ahead and talk about increasing efficiency. We want to make this as simple and as easy as possible for everyone involved in the life cycle of managing a clinical engineering or biomed department. The first step in any work order journey is at the point of it being created. What we find is oftentimes work orders are being created or broken equipment's first being identified by the ones that are most often interacting with that, whether it's the nurses or the different staff within a hospital. At the point of then identifying that there may be an issue with the device, there's many different types of channels that they can request that device to be fixed. Historically, what we found is that's often done either through, just simply tapping on the shoulder of a technician that's walking by, or putting a sticky note on it and rolling it out into the hallway. A way that we can make this process that much easier and that much more seamless is, once again, using technology to be able to enhance that end user experience. One of those ways is through a self-service portal. So here, I'm once again a logged in user. I have just a simple URL that I've pulled up. And this would be a scenario of where I'm a nurse. So I've identified a device that is no longer working, and I'm going to go ahead to submit or report that issue. Within this, I can also see things like the work orders that I've already submitted and the status of those work orders. I can also see any type of known issues or major events going on within the hospital. And then I have the ability to then go ahead and create a work order. So this is, once again, just a way that we can make it easier for the end user. As we're going to submit it, you can see a lot of this information is being automatically captured. Let's say, for example, you want to request a specific unique identifier for a device. At the point of typing in that unique identifier, you can also see active work orders to help reduce duplication. I can add different documentation or images to this work order. At the point of submitting it, it can then go through many different routes, whether it's going directly to an external provider or vendor, whether it's going to your own internal department, or perhaps it's going to a dispatch to then determine exactly which or who it should be assigned to. Another way we can help make the request process that much more easy is giving them the ability to submit a work order on a map. What we'll see here is the ability to pull up a floor map of exactly where we're located, select where that issue is, whether it's a problem with a medical device or maybe even a spill. But here we can see all of the active work orders. And then when we select that space to submit a work order, we're presented with a very similar form to the one that we saw before, capturing the location, perhaps entering in what the issue is. At the point of then submitting, it'll then also display on the map. This is a way we can help increase efficiency, not only from the end user side, but also from the individual or team responsible then for addressing that issue. Perhaps that's your external provider. At the point of this work order being submitted, they can then pull up on a map and see exactly where that work order is within the organization. Let's now talk about scheduled maintenance, automating the process of your day-to-day, monthly, quarterly preventative maintenance. And this can also then be automatically assigned out to your external vendors, whether it's going to your imaging specialists or whoever it may be. But as you're setting up your scheduled maintenance, this is a process that you can do once, and then once it's been complete, it can then apply to all of the devices based on the criteria that you've described. So as your own internal team builds out their preventative maintenance, you can say which type of programs are either on an AEM or manufacturer recommended plan. Within that, you could describe exactly what type of information you want to build out that criteria, whether it's at the asset type, the model, manufacturer, the risk score. And then you can define exactly when you want this to happen. As I said, this is something that you can do once, and it can apply to all of the equipment that falls underneath this criteria. Within this, we can say whether it's calendar, something like, every on a reoccurring schedule, floating, which takes into account the last time it was performed. So let's say, for example, every 2 weeks, every quarter, or utilization, where we can even pull that information in from a device, things like scans, number of uses, and automate the scheduling of this work order. In this scenario, let's go ahead and just take a look at a floating. Perhaps it's a quarterly. We can describe exactly how many days in advance we want this to be assigned to a specific external vendor. We can say how many days do they have as a grace period. And then also you can do things like estimated effort to give you visibility on your upcoming demands so you can better resource plan. What you can also do with this is plan out what materials and parts will be needed in order to complete this scheduled maintenance. This then not only gives the ability to plan as the technician's going out to fix it, but you can also do resource forecasting for the parts and materials required. We spent a lot of time talking about, work order, service history. We'll now go ahead and take a look at how we can enhance the invoicing process associated with a work order. So as we're thinking about increasing efficiency and saving time, this is a way as an external vendor receives this work order, they can go ahead and add their line items directly to this. And what it does is then when the work order gets closed out, it'll then be grouped into an invoice where a specific individual can be reviewing those invoices that comes in, and they can also approve, reject, and view all of the service history as well. But just to give you a quick idea of the process, here as this work order's been assigned, we go to complete it, we can add our itemized costs. Here you can see things like labor or parts, but just as an example, I'm going to quickly just show you how you can add a specific part to this work order. Let's say, for example, it's coming off of, my own truck, or it's coming from a specific stockroom. We can quickly identify the part that we're adding to this device. You can see not only the parts that are associated to this device, but also the available quantity and the cost associated to it. At the point of then adding that part, you can designate exactly which stockroom you're grabbing it from, and then the quantity that's being deployed. What you'll notice here is this auto-calculate. This is a way to make it very easy for your external vendors to be able to say, this is how much it costs, and this is pulling either from your parts discounts, the costs associated with procuring that specific material, or if it's a labor rate or whatever it may be. But you can see here it's automatically calculating the cost, and at the point of updating, it then goes into my itemized cost, which is also capturing things like the itemized cost or work estimate. Going back to the work order here, we've just added this part. And as you can see, this is also falling in line with our estimated cost to complete this, things like labor cost, materials. Once I've completed this work order, it then also will group into the financial costs of maintaining the specific device, which will give you a better visibility into repair versus replace decisions. Something that I haven't covered just yet, but while we're here, let's just quickly talk about, the ability to order parts or procure a part if it wasn't already in a specific stockroom. Let's say, for example, it was available in a stockroom, but not within the local hospital that you're in. You can initiate a transfer order for that to be sent from one stockroom to another. Let's say, for example, that part didn't work or was not available at all. What you can have is also the ability to do parts punch-outs. So let's say, for example, we want to order it from Parts Source or GE, or wherever your parts provider is, directly within the work order without leaving the screen. You can go ahead and initiate that procurement, submit it, and can go through an approval process if need be. But that's a way that, again, that we can help increase efficiency by giving you the ability to do everything within one place. What we find is that oftentimes organizations' processes, the type of data that they want to collect, changes on a reoccurring basis. Let's say, for example, maybe instead of 5 different types of priorities, you want 4. Or maybe you have specific information on a work order that you want to be captured. What I'm going to show you now is how you can take advantage of the ability of easily configuring a work order. With an application like Nuvolo, you only want to give this permission to a certain number of people within the organization. Perhaps it's 1 or 2. But with that ability, it then allows you to add different fields and update the form that we're looking at. So then when a vendor then accesses this work order, they have specific information that they need to capture. Just to quickly show you what I mean here, what I'm going to show you is how you update this form, again, with the right permissions. But here you can see on the right-hand side, here are all of the fields that we're currently tracking. On the left-hand side, you can see all of the historical or available fields. And then we can also create our own. So let's say, for example, you determine as an organization, you want to start tracking, who submitted this. Let's go ahead and call this requester ID. We then add this field to this form. You can see here, we can determine exactly where we want it to sit within this work order. And again, you can do this with any form, whether it's a device or work order or schedule maintenance. And then at the point of then adding that to the work order, you can then see this and then track and report against it. What you can also see, as I mentioned, the idea of making this mandatory so that when a vendor goes to complete this, this is something they need to complete. What you can see here is just by simply checking the box, this has now become a mandatory field. You can also think about making it read-only, so perhaps it's a field that they can't update or change. But once I've made that mandatory in order to close this work order out, they need to enter that in. So you can see here, as I then go to update or close it out, it says, please fill this information in before you complete this work order. So it's just another way that, this types of flexibility can help make your organization move that much quicker. Let's now go ahead and transition to the idea of once this information has been captured, getting it into an invoice and then having the ability to go through your digital approvals to approve a specific invoice. So as you can see here, we've entered in that necessary information. And at the point of then going to close and complete, what you can see here is it also prompts me to fill in other information. Perhaps it's a resolution code that you may be tracking. So once they've captured that information, capture what service date they're on site, you can go ahead then and then set it as close complete. Once it's set as close complete, all of your itemized costs will then group together into one invoice. This then makes it very easy for everyone involved to understand and quickly describe the costs associated to this work order. You can see here, we can also view it in some type of print view, which you may be very familiar with, seeing the item description, the work order is associated with the cost, any type of tax that may be automatically applied. And then also the approval process. So here in this scenario, I'd be a vendor going to submit a work order. But let's go ahead and just give myself, 2 different roles. Let's say I'm also the person that would be approving this. What you can see here is as I'm then approving it, I can then say, it's been requested. I can go ahead and approve it. And at that point, it then can get paid out through your financial system. And then all of your different types of approvals that are taking place, you can then have visibility into, what type of invoices are pending. What's the total cost? Here you can see invoices tracking this quarter. So kind of a more realistic example is here, right? I'm a director supervisor within a specific biomed group. I can see not only all of the other information like compliance and health by department, but also, as I mentioned, tracking invoices. So when an invoice is complete, submitted, you can then view these invoices. You can go ahead and see exactly what work was completed, see the type of work, see who completed it, when they were on site, any type of documentation to bring this full circle. Perhaps it's a picture, perhaps it's a signature. Any type of SLAs, how they completed and compared against the SLAs that they were assigned. Specifically, what contract coverage was in place. Any type of resolution details, how they completed it, what type of notes was involved. And then also the idea of work notes where you can communicate with different individuals that were involved in this process. So then going back to then view and confirm this to pay this invoice out, we have our invoice, we can go ahead and update the status as approved, and then at that point it can then initiate different things like automatically being sent to your financial system to get paid out to the specific vendor. So now to quickly transition into, we've talked about how to help increase visibility within the organization by having real-time updates on status changes, who's involved, what needs to be completed, when was it completed. Increasing accountability, the idea that when something complete, or perhaps if something's been assigned, making sure that your external vendors or a team is following through the procedures and the different SLAs that were described when this was first assigned. And then also increasing efficiency, taking advantage of point of service, using a mobile application, making it very easy and simple for your internal customers to submit a work order request. And also the idea of digital invoicing. So when a work order is completed, adding the itemized costs and grouping that all into one invoice to make it very easy for both the vendor and the internal team to approve it, pay it out. I quickly want to finish today's presentation before we answer any questions, talking about the ability to determine your in-house and external blend, and doing that through skills and competency management. So what we're looking at here is managing the competencies and skills within your own internal team. This then gives you visibility on perhaps what you want to do or what type of hires you need to make to be compliant or certified in a specific area, or what type of work do you need to outsource to a specific vendor. What you can see here is we have the different models that you may have within your organization. Within that, you can understand exactly who has the ability to work on that. Here you can see different type of vendors or perhaps technicians that are certified. Understanding what type of certifications are within your organization. Who's a certified imaging tech or a certified laser technician. Also, when those need to be renewed. Understanding not only the certifications, but also how that works at each different site. So here you can see how many different types of certifications you have at each location. Understanding exactly the different individuals and what their certifications are. So here you can see in a very simple view, you can see Chad Till's different type of certifications that he may have. And then also the concept of skills. So understanding what skills they may have outside of their certification or maybe in line for certification. And then also, just like we looked at up here, but also viewing it by site or the specific individual and the different certifications that they may have. So at this point, I'll go ahead and pass it back to Linda to then field some of those questions that have come in throughout the presentation.
Great, thank you so much, Peter. Yes, we have got a lot of questions. The questions we don't have time for attendees, I will be forwarding to Peter to answer directly to you. So please be patient. Anyway, Peter, the first question we received is, does Nuvolo have any healthcare vendors that use their platform?
Yeah, that's a very, very good question, because not only are there efficiencies to having your vendors operate in an application like Nuvolo where everything's being digitalized, but also taking advantage of not only the health system using the same application as the external vendor. So Nuvolo has a number of different customers, some of those being GE Healthcare. So as they go on site to submit their work or complete their work, they're using the Nuvolo application. Siemens or or more local or regional shops, and the list goes on. But that's just an example of some of the field.
Okay, so how does your system integrate with other vendors?
Good, good. So that's another option, right? So let's say, for example, we looked at processing through a work order within the Nuvolo mobile application. Well, let's say in the scenario that the vendor that you work with, they have their own CMMS application, and that's the one that they're going to use. We have the ability to integrate with the CMMS application that they're using today. So what that means is when they go up and pull up their specific technology in their application and update the status of a work order, automatically that information is being passed into Nuvolo, so your own internal biomed team can have real-time insight into what's being completed out in the field.
Okay, so can vendors also work in the same system?
They can, yes, they can. So what we were looking at when we first started was the concept of the vendor portal. And technically, they're working within the same application that you have as an organization. You simply have an abstract of a place where you're assigning work to them. They go to that place to view the work orders that have been assigned to them, complete the work orders, add any itemized costs, submit it. That's all being done within one system. So that allows you to, again, have insight into what's going on.
Do you also have parts integrations with vendors?
We do, yeah. So, there's a number of different, obviously, part suppliers, but just an example of some of the ones we quickly glanced over were things like, GE, parts punch-outs, part source, and then also some integrations with some calibration tools, things like Fluke.
Okay. What is the most common mistake made in vendor management?
Very, very good question. So, vendor management is a very difficult program to manage because there's so many different types of variables that are going on, right? You want to make sure that the work that's being completed is done quality. You want to make sure that your vendors that you're working with are very happy, invoices are getting paid. But when we think about the largest challenge or mistake working with your external vendors, it really comes down to the visibility aspect of this, where, a lot of times it's very, very difficult to be tracking what's being done, but it's important, no matter what type of tools or systems you have in place, it's very important to keep track of what's being done out in the field by your external vendors. The reason is because that all of a sudden becomes a big issue when it comes to compliance for your JCO. So visibility is definitely the largest mistake is, letting your external vendors come in, do whatever, has been assigned, and then, waiting till the invoice shows up. But it's important to stay on top of your vendors so you have visibility on what's going on.
Okay, that's great. Following on from an invoice question, how does your invoicing process tie into PeopleSoft accounting? Do you use PeopleSoft data and fields of your own, sorry?
Yeah, so in the scenario that we'd be integrating with a financial system, so, the scenario would be the invoice is approved, it's going out to the financial system to get paid out, or perhaps, coming from PeopleSoft to Nuvolo. The data mapping, the field mapping, that can be exactly aligned with every type of financial system you may use, whether it's PeopleSoft or Oracle or whatever it may be. But you're right. So it can be bi-directional. So data can be going back and forth from your financial system to Nuvolo. So that way you have a full cycle and full insight into everything that's going on.
Okay, that's great. I've got another question here. It says, requester ID should be from their Active Directory structure. How would you map that field to be automated to the AD credentials?
Yeah. So, there's many different types of integrations we can set up. And also Nuvolo is built on the ServiceNow platform, if that's something you're familiar with. But ServiceNow is often being used for your Active Directory. So if you're using ServiceNow for your Active Directory or something else, that's information that can be simply feeded in real time or automatically, or perhaps on some sort of schedule to make sure that all of that information's in there. And then also tying it back to your AD. application as well.
Great. Where do the parts inventory and costs come from? Is it previously entered parts, and what if it's a part you have never used before?
Yeah, so, the concept of managing your parts, your inventory. So let's think about, a part associated with a work order, right? You're adding a part to a work order. If it's already within the application, it would be something that's already within your stockroom, right? It's available in a stockroom, or perhaps was available in a stockroom. If you need to initiate a purchase or a replenishment of that, that's something you can do as you're in the work order, or that's something that can be automated. So actually setting replenish thresholds for the parts that are typically being used. But in the scenario that that part is not available in a stockroom or has never been available in a stockroom, that would then follow your procurement process. So once you've procured a specific part, maybe it's through a punch out, maybe it's through your own internal process, or even within Nuvolo, once that part's been purchased, that model, the specific model, the different unique identifiers for that, that'll then be entered into Nuvolo's application as it's being onboarded. Maybe it's a consumable, or maybe it's a specific identifiable part. But once it's been entered, you can then just simply track the quantity against it. So then when you add a part and you pull it off the stockroom, you can simply select that specific part or the type of part that you're pulling. The quantity and the cost would be automatically calculated and added to the work order. So it's something you don't even have to think about.
Okay, that's great. Now, another question is, what devices have you been able to automate the scheduled maintenance by volume, like ventilators for operation hours, CT scan seconds, etc.?
Yeah. So there's a number of different ways you can trigger your scheduled maintenance. It sounds like one of the ways that you're referring to is, through utilization metrics. There's all different types of utilization metrics you can generate your scheduled maintenance off of, but some of those being scans, number of uses. When you think about in the facility space, a very common usage of Nuvolo's application is through runtime hours on your HVAC. So as the specific device is running, it's capturing the runtime hours, communicating that back to Nuvolo's application, and then once you've set that threshold, maybe it's after 1,000, 2,000 hours of runtime, a scheduled maintenance is automatically created, assigned to a specific individual to address that. So if it's a medical device, number of scans, there's many different ways we can think about it. It's also something that can be manually captured as well. So, manual, when you think about the, replenishing the oil in your car, that's something that would be a manual utilization process, right? Once you realize it's hit that certain threshold, you then go ahead and get your oil changed. So either it can be automated, pulling information off of the specific device, whether it's IoT or if it has a scanner on it, or it could be a manual. You identify it's gone over that threshold and it needs to be remediated.
Okay. Is there a best practice to have vendors agree to utilize this application?
There is, yeah. So working with specific vendors, right? Every vendor is going to have their own way of operating and also their own type of specific CMMS application they have or are currently using or their own process. As a best practice, it's something that you want to have a conversation on through the contracting process, or perhaps even adding it within your contract. Because when you think about, the partnership, the mutually beneficial partnership you have with your external vendors, they want to be able to provide you an enhanced customer experience. Part of that customer experience is giving you real-time updates on what's being completed, giving you real-time updates on the work order line item costs and the costs associated to the work that they're performing.
Okay.
And then within the mutually beneficial...
Sorry, Peter, carry on.
Yeah. Then I was going to say, within the mutually beneficial relationship, also, they want their invoices paid as quickly as possible. They want to know whether something's been approved. They want to know, what type of SLAs and if they're performing well. So it's a conversation that you can have either in your contracting process or or perhaps, if you're already, you've employed them, it's a conversation making sure that all the data, the work that's being performed is going in full circle.
Okay, that's great. We've got time for one more question, Peter. How many vendors has Nuvolo connected with so far for outside vendor work that is fully integrated into the Nuvolo program?
Wow, yeah. So that's a tough one to give a specific number on because we've worked with so many. I would say when there's many different ways we're communicating or connecting with an outside vendor, whether the vendor's using Nuvolo already, we're actually having an integration set up between the vendor, or it's some vendor that's been receiving work orders through our vendor portal. So when you think about those three different scenarios, we're really up into the thousands of different vendors that are operating, whether it's, one of the larger ones like a GE who's actually using Nuvolo, or even a more regionalized one who might be accessing Nuvolo's application, mobile application, or going to the vendor portal. So it's something that, it's difficult to put a real number on, right now, but if there's one that you have in mind, we'd be happy to have that conversation.
That's great. Thank you, Peter. We're coming up to our hour allocation. So just a reminder, attendees, we have got questions that I will send to Peter to answer offline. So don't worry, they will be answered. Thank you, Peter, for another great and informative webinar. And of course, thank you again to today's sponsors, Nuvolo. One lucky attendee will win an Amazon gift card for completing the post-webinar survey. Details will appear on your screen shortly. You must complete the survey to obtain your certificate of attendance. If you don't see the survey, please email us at webinar@mdpublishing.com. For more information about our upcoming webinars, please visit our website, webinarwednesday.live. So thanks once again for your time today, and we look forward to seeing you at our next webinar Wednesday. Enjoy the rest of your day.